If you're struggling with deciding whether to put your elderly parent into long-term care or to have them transition from short-term care to long-term care, today's video is going to talk about some of the things that you as the family member doesn't see, how well your parent can acclimate. Before we continue, I just wanted to quickly introduce myself. I'm Tammy Provencal. I'm a dementia certified physical therapist and a life coach. And I wanted to emphasize that the videos that I make are separate from my role as a physical therapist working in short-term rehab and long-term care facilities. I've been working with elderly patients and their families for 20 years. I see the struggle, especially in the role of caring for our parents. There's a lot of emotions that are involved in that. So these videos are part of my effort to bring information and strategies to the families that are struggling with how to care for their aging parent. I hear from a lot of people about the guilt that they feel when it comes to putting their loved one, their elderly parent, into a nursing home, or when it comes time to transition from short-term care to long-term care. As a physical therapist who has worked in this type of facility for 20 years, I see how hard it is for families to make that decision. This week I had a family make that decision, and as I came across them in the hallway, two sisters were together and they were crying and hugging each other. So I stopped and talked to them, and some of the things that I realized over the years that families think is that because their family member is complaining, they're angry, they're maybe crying, depressed, when family members are there, I think a lot of times families go home and they feel so many emotions because they're envisioning their family member continuing to be sad or angry or frustrated after they leave. But often the reason that people are transitioning to long-term care has to do with them having a diagnosis of dementia. And with dementia comes short-term memory loss. So what I've seen over the years is that when family members leave, the memories associated with that family member is also gone. And in this case, it can be a good thing because it means that when the family leaves, the resident isn't continually crying or continually upset. Most often they move on to something else. The staff in the facility will take them to activities, or it's time for lunch, or they have rehab. So I wanted to do this short video because I want to urge you as family members not to go home and imagine that your loved one is still depressed or angry or frustrated, because that's usually not the case. We as family members often bring up a memory, even if it's not conscious, of their life before. And so when we're around, that memory sometimes is around. But please remind yourself that it often goes away once we're not around. And in the case that your loved one does continue to be depressed or frustrated, angry, the staff at the facility should be trained in how to deal with somebody in those situations, including how to respond to people with the diagnosis of dementia who are also exhibiting this frustration or anger. I made another video on how to make it easier to help your loved one to transition into long-term care. If this video was helpful, please subscribe and share it with anybody else you think might find it helpful. And please subscribe to my channel for more videos. Thanks.